Hi, I'm Stuart Spinks and welcome to my YouTube channel, Stuart's Beekeeping Basics. Today I wanted to follow on from the previous video where we were out in one of my apiaries taking some samples to test for Nosema. And there was one colony in particular that I was unsure of and wanted to sample and just check for Nosema because they were behaving in a rather sluggish way compared to the other colonies on that particular day. So if you haven't seen that video, do take a look at it. It just shows how you can easily take a sample of bees from one of your colonies in the winter time. It's very straightforward and then allows you to remove that sample and do a testing on it for Nosema. The test for Nosema is fairly straightforward to run. You do need a high-powered microscope, but to be honest, it doesn't have to be the most expensive in the world, and you can pick them up relatively cheaply. I would recommend having a look at Brunel microscopes here in the UK. They do ship worldwide, but I'll put some links down in the description below, so do take a look at their website. They've got some fantastic microscopes to suit all levels of experience and budgets. So Brunel microscopes, those are the guys to go to. So let's just go over again a little bit about Nosema. There are over 200 different types, but fortunately only 2 of those types affect honeybees, Nosema apis and Nosema cerani. They're what's known as a spore-forming parasitic microsporidian. So spore-forming in that they produce spores which the honeybees ingest. A parasite, as you're probably aware, is where one organism benefits at the cost or expense of another organism. So in this instance, Nosema is the parasite and the honeybee is the host. And microsporidian refers to the scientific classification. So this particular parasite is part of the fungi kingdom of classification, and the microsporidian bit actually refers to the way this parasite is made up, the structure of it. So it's a really fascinating thing actually, and an incredible piece of engineering. If you imagine on a microscopic scale a grape shape, so we've got an oval shape, and inside of that the Nosema has a tubule, a filamentous tubule, and that's like a tiny hypodermic needle, and that comes down straight from the tip of the actual spore, and inside it curls around the inside, and that acts as a spring, if you like. It's a coiled spring ready to explode. So with Nosema apis, the honeybee is only vulnerable in its midgut, its ventriculus, and the Nosema spores find their way through into the midgut and locate the epithelial cells. So those are the cells on the folds of the inside of the midgut. When it locates the position it wants to be in, and I guess that's a chemical signal, it actually explodes out of the end of the spore. The coil inverts the tubule into the cell, and then it passes its DNA material through that tubule into the cell. From that point on, it goes into a phase called merogeny, which is where the cell divides, and then you have multiple Nosema cells that are developing inside the epithelial cell. Those then switch from the merogeny to a sporogeny phase, and that's where the spore forming phase or the spirulation takes place. And each of these infected honeybees can have as many as 30 to 50 million spores inside them. So that's how Nosema apis infects the honeybee. Nosema cerani is somewhat different because that can infect a multitude of other areas as well. So the alimentary canal, hypopharyngeal gland, salivary gland, fat bodies. So in effect it can be a lot more infectious than Nosema apis. So from the practical perspective, we're looking at a colony that probably is going to be a bit lethargic. You will hear people say that dysentery will be a sure sign of an infection of Nosema, but that's not always the case. But you can expect the bees to be quite sluggish and lethargic, and potentially they won't be out flying from the hive quite as frequently as maybe a healthy colony. So we've got our sample of bees that we've taken from the colonies, and we're now going to run that test. So what I'll do is I'll show you the equipment that we've got here laid out. There's not a huge amount of equipment that's required for this test, but you just need to follow a methodical process in order to check each of the samples that you've got. Now, there are several different opinions as to how many bees you need to take to get the correct sample diagnosis. For me, I'm really only interested in whether it's a positive or a negative. We have low, medium and high infection rates, and if it's a low infection rate, then potentially you don't really need to do a great deal about it. The bees can cope quite easily. If it's a medium or a high infection rate, then from my perspective it's something that I would tackle immediately. I wouldn't allow that to advance through into the summer. And I'll talk a little bit about what I would do to rectify the situation and help the bees improve their lot when we get towards the end of the video. So it's not a case that if you have Nosema there is nothing you can do about it. There's lots that you can do to help the bees, and it doesn't involve using any of the antibiotic treatments that have been available. Here in the UK they're no longer authorised for use for Nosema, but I know that they are used globally in various countries, and some beekeepers use them prophylactically, so they just treat everything. And I think that with the current situation with antibiotics as it is, we really need to be looking after what we've got and not contributing to the problem potential loss of effectiveness of all of our antibiotic drugs. So let's have a look at the samples and the equipment that I've got, and then I'll show you exactly what I do in taking a sample, and then we'll have a look at the slides on the microscope and you can see exactly what I see. So here's our equipment. We've got a water bottle with some fresh water in. We use that just to add some liquid to the samples. A glass rod for taking a sample and placing it on our microscope slide, which we have here, just a standard microscope slide. And then we've got a little card guide here. It just shows me the center of the slide so that I can get my sample in the dead center. Then we've got the cover glasses which go on top of the sample before we put it on the microscope. A pestle and mortar for grinding up our sample. We've got our samples here. And then we've got our stain, and this is a nigrosin stain, and this is called a gram-negative stain, and it doesn't actually stain the sample, so it doesn't give the Nosema spores a stain. Rather, it darkens the background and the Nosema spores stand out from that. And then we've got our microscope, and this is a Brunel microscope's trinocular. It's got this tube at the top which allows me to attach my camera so that we can then take some images. It's got a light source in the base, and it's a really very good microscope for a really good price. So I'll put the details in the description below, and you can have a look at that and go across to the Brunel Microscope's website and take a look at the specification on it. So to start with, I'm just going to take one of the samples and go through the process that I would normally do with a standard Nosema testing that I would do for myself. So let's have a look at how that works. So I have my sample of bees, and I've got the identification details here. So I'm just going to pop all of the bees into the pestle and mortar. and that's a sample of 30 bees. And then the next thing that I do is to just grind them up. And now I'm going to add a small amount of water just to create a liquid. And that's just maybe 1 or 2 mils, barely that. And what I have now is all of the bees crushed, and if I just exert a small amount of pressure, you can see that there's a liquid in there that I can now take a sample from. So I have the liquid, and I just get some and place it into the middle of the slide. The next stage is to add some of our nigrosin stain, and this is where we use the little glass rod. So the glass rod is perfectly clean, and we just dip it into the stain and place a single drop onto our sample and just gently mix it together. The glass rod goes into the pestle and mortar, and don't forget to put the lid back onto the stain because it will go everywhere if you knock it over. So now we have our stain mixed with our sample, and the next step is to put a cover glass on top of that. And now we have our sample on our slide ready to go under the microscope. So the good news is I can't find any Nosema, but that's also bad news because I'd like to have been able to show you what we're looking at. What you're seeing here are various grains of pollen. There are body parts, so let's see if we can find something of interest to show you. So here we've got several different pollen cells and also some bee body parts that have been crushed up, but there are no Nosema spores that I can see in this sample. And what we would do is go through the sample little by little, gradually moving the slide and focusing through the different levels of the sample to try to identify the Nosema. And then we gradually move on until we've completed a sweep of the entire slide. So I'm happy that this particular colony does not have any serious Nosema infection. So here we have the second sample, and on the face of it, it looks in fairly good condition. And again, we'll work our way through the sample and just check to see if we can see any telltale signs of Nosema. And here in the middle of this particular image, you can see quite clearly an oval shaped cell, and as I focus through it, you can see that it's quite clearly centered, and that is a Nosema spore. So let's just see if we can find some more spores. There we have another spore. And there again we have another Nosema spore, dead centre. And again another one, dead centre. And whilst it's difficult to be absolutely sure, the difference between the Nosema apis and Nosema serrani is that the serrani tend to be slightly more curved, so they have a slight kind of banana shape to them, very, very slightly, nothing that I would describe as a banana shape, but the Nosema apis tends to be more rounded in its form. So there in the middle we have a Nosema apis spore, and if I can find it again, gone too far, the previous spore that we saw, this one in the middle now, would appear to be Nosema serrani. So having looked through this slide extensively, this is the worst section of the slide that I can find, and here you can see several Nosema serrani spores, but there's also a Nosema apis spore, which is the rounder spore. And so here's another sample, one of the other colonies, and this one I've only been able to find one single Nosema spore, and you can see that in the dead centre as I just focus through the different levels. So that's 4 samples that I've tested so far. One of them has a very light infection, the other has a light infection, and the other 2 were completely clear. So far everything's looking fine. Now on the final colony that I want to test, this is the one that were behaving quite sluggish, a bit lethargic, and weren't flying when every other colony in the apiary were flying. So I'm already thinking that there may be a more significant problem with this colony. It might not be Nosema, but there's a chance that it could be. So with this colony, what I've done is I've taken a sample of 50 bees, and I'm going to test each one individually. So I'm going to crush and test each individual bee, first of all to a sample of 10. So I'm going to take a random sample of 10 bees from the sample that I've got. So if I'd been at the hive and just taken a sample of 10 bees, we'll test each one of those individually, and we'll see what results we get from those. And then I'm going to add another 20 bees to the mix so that we have a sample of 30 bees and see what we get. And then I'm going to add the remaining 20 bees so that we have a total sample size of 50, and compare that to the samples that we'd taken earlier. And I just want to use it as a comparison to see whether a different technique might be more effective or simply just means more time and in fact wasted time on my part. So far with the samples that I've already tested, I'm not going to need to do anything with those hives specifically because of a Nosema infection. I'll continue to go through my normal spring cleaning that I do in the coming weeks and months, and we'll do some frame exchanges as well. But other than that, there's no need to worry about these colonies at all. And when you stand and look at them, they look really healthy, and the bees are flying and bringing back pollen, and everything looks fine. Okay, so that's the testing completed, and I have to say it was a total pain in the backside. Crushing up one bee at a time is enough to drive you crazy. I did the 10 bees individually, and then I did the next 20 bees, so that made the equivalent of a 30 bee sample, and then finally I crushed up another 20 bees and tested those, and the results are fairly conclusive. It really doesn't matter how many bees you take as a sample if you've got a healthy hive and there's no Nosema there. They're completely clean and there's no problem with them at all regarding the Nosema. So that particular colony has perhaps just decided that they don't like it when it's still a bit chilly and aren't prepared to come out and fly around, but all of the samples I had were completely clear of Nosema. So what I shall do is take another 50 bee sample from another colony and see if I can find some Nosema in those. I'm going to stick with my 30 bee sample. It just works for me, and I guess there's lots of beekeepers out there that like to look at the science of the whole scenario. How many bees can you get away with to get an adequate sample? How many bees do you need for a guaranteed sample, that if you've got a positive it's not some kind of false reading? But for me, I guess the issue is if I find that I've got either a medium or a high level of Nosema, I'm going to take action regardless. So it doesn't really matter to me whether it's 1 or 2 bees out of the sample of 30 that are absolutely loaded with Nosema, because that's going to spread through the colony. So I would rather know that there's Nosema in the colony and take action. So with all of these colonies that I've got, we've got the 2 that have the light and very light infection. They're not going to really need any form of aggressive treatments, so I won't need to carry out a Bailey comb change, for instance. But what I will do is carry out my spring cleaning and do a few frame changes as I do with each hive over the spring and into the summer. And I'll come on to a full spring clean and what I do with my bees in the spring over the next few weeks. Don't forget, we are on Facebook. We've got our beekeeping group, Stuart's Beekeeping Basics. I also have my Twitter and Instagram feeds. We're about to release to the general public our podcast, but if you want to catch that early, then pop over to our Patreon page, where you can also get all of the extra videos that we're going to be doing over the coming months and into the summer. From the beginning of March, we'll be producing 3 videos a week again, 2 of which will be available on Patreon. The third will be available on Patreon and be posted to YouTube. But if you want to take a look at more of our videos, then please pop over to Patreon, and for just $1 a month you can have access to all of the videos that we're going to create this summer. I've now got the unenviable task of clearing up all of this mess, so I'm going to crack on with that, and I'll catch up with you next time. Thanks for watching.